Darden.
Hey, how you doing?
I'm good. How are you?
Good, good, good.
Well, first, I wanted to thank you for being my pediatrician for way over 12 years. And I wanted to get the story out to the public. Do you have a moment?
Sure, it's cold out here. Come on in.
You're open?
Sure, come
Okay.
on. Come right on in.
Thank you.
All right. Get your coat off and we can talk a while. Yeah, come on in. We can go in the back and talk this way.
Okay.
Right on through there. And we can go in the back and make a left turn. And we can talk in one of the rooms here. That's good.
Well, Dr. Darden, can you tell me a little bit about your background? Stuff like your education, your medical training, and your certification?
Of course, I went to high school. Everybody does. After leaving high school, I went to college and got a BA degree. And my major at that time was biology. That was what I liked. After that, I went to medical school, and I went to Williams College for college. I went to Howard University for medical school. And after medical school, what you have to do is you have to go for training. I decided to go into pediatrics for training. A lot of people do internal medicine or OBGYN or other fields. So I went to the Children's Hospital of Northern California, which is in Oakland, California. I spent 3 years there. Loved it. Didn't want to come back, but that's all right. Came back to Washington after finishing my pediatric residency and worked at the Children's Hospital here in Washington, D.C. What I did there for 2 years was pediatric and adult allergy and immunology. This is what we call a subspecialty. And a subspecialty is what you would call your specialist in the field of medicine. So I spent 2 years at Children's Hospital. We did our adults at Walter Reed and we did our adults at GW Hospital. But the bulk of my time was at Children's. And in 1983, when I finished that fellowship program, I decided to literally hang up a shingle and start my private practice.
Okay.
I've been doing that since 30 years ago.
Wow, 30 years. Well, my second question for you is, do you remember when exactly you wanted to become a doctor and why?
Got to tell you a story on that one.
Sure.
I really, when I was a kid, was not interested in becoming a doctor. I was fortunate, though, because I had doctors in my family. My father was a physician. I had an uncle, I had 2 uncles in my family who were physicians. And I have an uncle who was a dentist. But when I started out in elementary school and even early junior high, being a doctor was not on my list. And you know what I wanted to be?
What?
I wanted to be an astronaut. And people who know me, they say, what? But that was what my boyish dream was about. I loved the natural sciences, and I don't know why, that was just a part of me.
Right.
But aerospace and rockets and other planets just always intrigued me. Now, what happened was that when I got into high school, you got to understand this was a very different time. This was in the late 60s. In the late 60s, there was a lot of difference in terms of regulations and rules, especially when it came to healthcare. I was very fortunate to get a job in Cincinnati, Ohio, working at a tiny little hospital on the west end of Cincinnati, and that was the part that a lot of the poor folks went to. It was called St. Mary's Hospital, and I'll never forget a woman there who wasn't a supervisor, but she helped me get the job. Her name was Mamie, and I don't remember her last name. But I got a job there as a respiratory therapy assistant. Now these days, as a high schooler, you're not going to be able to do that. What I had to do, and I started out in the summer, was to go around to patients to give them breathing treatments. These were people who had lung diseases and asthma and other kind of respiratory ailments. And so I'd go in on Saturday and give these medical treatments. So I spent my junior year, I think this was between my junior and senior year during the summer, working in this hospital. And I liked it so much that I ended up working there during the school year on weekends. Now here's the main thing. There was one time where Mamie, who was a nurse, said, "Would you like to see an autopsy?" I don't want to be morbid about this, but I was able, at I think 16 or 17 years of age, to see my first autopsy. And here's the thing that really hit me. The person who the autopsy was being performed on, and I went, was a patient of mine. No, he wasn't a patient, but he was a person who I gave treatments to for pretty much over the whole summer. And I got to know him quite well. He was an elderly gentleman, and he would always tease me because he thought I was a little kid, but he always called me Doc. These are things that kind of give you a little bit of incentive, you know. But it was his autopsy. And I was shocked when I got down there. She didn't tell me that it was him. But here was a person who I knew as a living entity. Now I'm seeing his body sliced and diced and weighed, etc., etc. That told me, when I was in that room, that there is a big difference between how you and I are at this point as living people as opposed to when we die.
Right.
There's something that's missing between those two entities, and that stuck with me ever since even today. That life itself, you can't see it, we don't really know what it's about, but it is absolutely precious and still very mysterious, I think, to not only me, but to everybody. Okay? So that, along with the family background, that job, the esteem I got on the job, really said, you know, well, since I like sciences, maybe this thing called medicine is where I ought to go. Wow,
impressive. So my next question is, what do you think about what's going on with healthcare in America right now?
This is 2010, about to be 2011.
Yes.
And of course, healthcare is a lot in the news. You hear about it in terms of the expense, and you hear more of it in the media about the cost. You don't really hear about it so much on the service side, what we do as physicians. I think the biggest problem I have with healthcare in this country is that taking care of that living entity that we call life and money do not mix. That's the crux of the problem. Taking care of a human being in their life from the time that they come out of their mama's womb to the time where they are beginning to try to open their wings to become full adults in this world. Okay? That is priceless. And yet we put a dollar value on it.
Right.
So I will always say, unless health care is removed from the monetary aspect of it, there will always be a problem. However, we try to do the best that we can. I do believe that health care should not be treated as a good or a service like other things that we do in our economy. You know, whether we're doing labor services or whether we're selling cars or whether we're selling furniture, that should be different from healthcare. So I have a lot of issues. Unfortunately, I don't have a lot of solutions, but it is something that makes this field very, very difficult. You and I know that a lot of people are getting getting wealthy on this thing called healthcare. But I do think we need to focus a little bit more on the part that says care.
Okay. Well, I don't want to take too much more of your time. I know you're busy, but I have one last question.
Okay.
And that is, what are the main things you're really trying to achieve with your medical practice of pediatrics and allergy care?
Okay. I think that, yeah, I take care of sore throats, I take care of fevers, I go to the hospital and make sure that newborns are okay, and if they're not okay, we do things to make them well. I take care of people who have headaches, I take care of people who have chronic asthma, people who have allergies. Those are real things, and I don't mean to undermine those things. Fortunately, in pediatrics, many of those things can be fixed, or there is a solution toward greater easement, okay? But I think in pediatrics, and I really think in other fields of medicine too, we need to go beyond that. First of all, there's that word called care. In pediatrics, what I'm really trying to do is to really foster development from that child who is 1 day of age to your age and beyond. That takes a lot more doing than just taking care of the illnesses that I talked about.
Absolutely.
I think that if we can do that, you have helped to develop a whole person, not only with their body, and of course with you all, you know I get on your mind.
Right.
Because I say all of you all are A students, but if you're getting C's and D's, I said I have a problem with that. But also as you get a little older, and with the help of the parents, to foster on your spirituality.
Right.
Okay? Your body, your mind, and where you are going spiritually is what we really should be about.
Absolutely. Well, thank you so much for your time and for your interview. I appreciate it.
It is a pleasure, and you're welcome back anytime.